Hello everyone, we present how artificial intelligence can improve stroke diagnosis by assisting scoring the stroke cases with well-documented technique-like aspects. What is stroke? A stroke occurs when something blocks blood supply to part of the brain, which is called ischemic stroke, or when a blood vessel in the brain bursts. This is called hemorrhagic stroke. Both are managed differently. In our work, we focus on ischemic stroke. Let's briefly define aspects. Aspects scores the severity of the damage caused by ischemic stroke. Aspects is a quantitative topographic CT scan score out of 10 points. You can see the 10 regions in the figure. In stroke cases, time is brain. The outcomes become progressively worse with time. Therefore, there is a need to automate process for prioritizing the patients, hence we develop deep aspects. Deep aspects take a non-contrast CT scan and outputs aspect score. To aid in development of deep aspects, we curated a dataset containing 8,000 infarction studies. Infarcts are oxygen-deprived parts of brain. We asked neurologists to mark the pixel-level ground truths for infarcts and MCA anatomy regions on 1,500 examples. Our deep aspects framework has three main components. 1. Infarction segmentation network. 2. MCA anatomy segmentation network. 3. Aspects generation function. In anatomy segmentation step, our model segments MCA territory into 10 regions as shown in the slide. Infarction segmentation stage involves segmenting infarct shade region of the brain. Third step in nothing but overlapping segmented infarcts with the MCA territory region and then calculate the aspects. Objective function used to train the model is combination of three well-known losses: focal loss, boundary loss and dice loss. Now, let's have a look at some results. This table represents model performance is segmenting different MCA territory regions. Though for the smaller regions like lentiforum nucleus, internal capsule, and insular ribbon, UNet is not the best model, but we can see that the variation is not very large between UNet and the best models. Next, let's evaluate our model for different volume of infarcts. The results are shown in the table. We can clearly see smaller the infarction, harder it is to detect and segment. Now we compare model with the two reader who scored the scans for aspects. We can also see that most of the time model has performed at par with both of the readers A and B in terms of sensitivity. Due to the subjective nature of aspects, we have seen that even though the sensitivity of our model is very high, they have very low specificity. Therefore, it is best to judge the performance of model based on binned aspects as shown in the table. The score was binned based on the treatment outcome given the score. Now let's look at the inter-reader variability of the aspects. As already mentioned, aspects is a very subjective score, it varies from reader to reader. Readers A and B has agreement of 39% for exact match, but if we relax the agreement criteria to be within 2 points, the agreement doubles to 73%. We observe that deep aspects matches the performance of reader A with relaxed criteria. With our work, we show such method have a high potential to improve the clinical success rate by alerting the neurologists about potential stroke cases with their severity reported as aspects. This helps in better management of stroke cases. Thanks everyone.